Hello, my name is Abarkanemi Wogu, and I am a fourth year medical student from Ohio University Heritage College of Osteopathic Medicine. I'm excited to present my research titled Exploring the Potential of Osteopathic Manipulative Treatment for Managing Musculoskeletal Pain in Children and Adolescents with Obesity, a narrative review performed by my advisor, Dr. Guzman. The objectives of this literature review was to examine the effectiveness of OMT in managing MSK pain in children and adolescents with obesity, focusing on treatment outcomes and its potential integration into clinical care. Obesity significantly increases the risk of MSK conditions such as blount disease and SCFE, leading to pain and mobility limitations. Overweight children experience more chronic and intense pain compared to their peers. And while OMT has shown promise as a non-pharmacological intervention for MSK pain, there is limited evidence supporting its effectiveness in childhood and adolescent obesity cases. My literature review aims to highlight this gap. In order to conduct this review, we used databases including PubMed, Scopus, and Google Scholar to identify primary studies on OMT's application for MSK pain in children and adolescents. The search included key terms such as osteopathic manipulation, joint pain, and sports-related pain. Studies were screened and analyzed for effectiveness, safety, and clinical feasibility. A total of 6 studies were included due to being studies on OMT for MSK pain in our target age range, 2 to 18, research assessing treatment effectiveness and pain outcomes or clinical integration, studies including overweight or obese pediatric populations, peer-reviewed articles published in English, and RCT, chart review, case reports, and case series. We excluded a total of 55 studies due to them not being peer-reviewed journal articles, studies focusing on infants and adults, studies involving patients with autoimmune conditions, studies unrelated to the use of OMT for the treatment of MSK pain, such as otitis media and asthma, and non-English publications. The literature review produced 3 main themes. OMT, particularly spinal manipulation, demonstrates varying effectiveness in managing MSK pain in children and adolescents, with some studies showing reduced pain intensity, improved functional outcomes, and enhanced patient satisfaction. However, these benefits are not consistently observed across different cohorts, indicating a need for a more tailored approach. In adolescents with chronic low back pain, combining OMT with exercise therapy has shown to provide long-term improvements in pain, disability, and overall satisfaction. However, despite these positive findings, the addition of OMT did not always result in significant reductions in pain recurrence or long-term disability when compared to other conservative treatments such as just exercise alone. OMT appears to be a safe intervention with no significant adverse reactions reported in multiple studies, supporting its feasibility and low risk profile when used in pediatric populations. Case reports and series demonstrate that spinal manipulation is well tolerated by adolescent patients, especially for conditions like mechanical low back pain, and may contribute to a quicker return to physical activity in sports. And despite mixed reviews in some studies, OMT is viewed as a potentially valuable complementary treatment for MSK pain in children and adolescents, particularly when combined with conservative therapies like exercise. Patient preferences and individualized care plans should guide the integration of OMT into clinical practice, with consideration given to the specific needs and responses of each child or adolescent. So while there is some evidence supporting OMT's role in alleviating MSK pain, its overall effectiveness remains uncertain. Key challenges include variability in methodologies, lack of standardized treatment protocols, and limited awareness among healthcare providers. To facilitate clinical integration, increasing provider education and developing guidelines for OMT use in pediatric cases are essential. So in summary, while OMT may be a beneficial, non-invasive option for managing MSK pain in children and adolescents with obesity, current evidence is inconclusive. Further research is needed to confirm its effectiveness and establish standardized treatment protocols. Increasing provider training and awareness can enhance OMT's role in pediatric pain management. Thank you for your time and attention. I hope this research contributes to the expanding role of OMT for the treatment of MSK pain in children and adolescents.